Hello, Mrs. Jane Doe. How are you? Hope everything is well. I wanted to talk to you about hyperbilirubinemia, more specifically in babies and neonates. And this tends to happen pretty much when there is some type of immune reaction from the mother, passing it on to the baby, and the antibodies attacking the baby's red blood cells. So, hyperbilirubinemia is basically defined as too much bilirubin, which is this substance that is found in red blood cells and can be secreted by the liver and all that stuff inside of the baby's blood. And how it gets there is kind of a complicated process, but you should need to know since this is your first time pregnancy, and we do need to do some testing to figure out whether we will have to intervene with immunoglobulin, the RhoGAM, which I will explain in a little bit. So basically, it starts off. We're going to explain the Rh compatibility primarily, but so pretty much the if the father of the child is Rh positive, and you, the mother, are Rh negative, there is a chance that the baby will be Rh positive. Now, Rh factors are these little proteins that hang out like outside of the cell, and because of these proteins, if the baby has these proteins, if the baby is Rh positive, that's what it means. The mother's antibodies can attack the baby's red blood cells, and that's no good because then we can cause the hyperbilirubinemia. But this happens in second pregnancies, not really first. So if you were pregnant and you are Rh negative and the baby is Rh positive, it won't have any effect for the first pregnancy because the body won't make the antibodies in time. But even during the first pregnancy, if there is a risk if you do get an amniocentesis or other traumas, which can cause the immune reaction around the placenta, and that could be troublesome. As for the second pregnancy, so let's say your second pregnancy, again, you're Rh negative and the baby is Rh positive. Because of passive immunity, the mother passing on her antibodies to the baby or to the fetus, it can cause an immune reaction and destroy the baby's red blood cells. So it can be a problem, and it could cause hyperbilirubinemia in a baby after the baby is born. So normally, in order to prevent these type of things, we do some testing. We find out if you're Rh positive or negative, if the father is, and also what's going on with the baby. So we will give RhoGAM at 20 weeks of pregnancy if the baby is Rh positive and you're Rh negative. And we will also give another dose of RhoGAM after 72 hours of delivery. What RhoGAM does is that it sort of stops the mother's immune system from making these antibodies in the first place, which is a good thing because then it won't attack the baby. But if you didn't get RhoGAM in the first pregnancy, then the RhoGAM won't be effective in the second. So we do have to catch these things now so we could give you the RhoGAM now, which is why these tests are very important. Let's see, because of so if the complications were to happen, not that they will since we are going to be testing you, but for information's sake, it would cause anemia in the baby. The baby would come out yellow, which is called jaundice, and that's because bilirubin is a bit yellow, so it shows up on the skin. And this could cause all types of complications, such as heart failure, because the red blood cells are being destroyed because of the antibodies. And because those red blood cells are being destroyed, the heart is working harder to compensate, which can tire out the heart and cause heart failure in the baby. Let's see, The liver is going to have issues because it can't conjugate the bilirubin in time, and the liver and spleen can't really compensate also for creating enough red blood cells fast enough. So it's going to create immature red blood cells, and just it won't do a good job in helping the baby's oxygen needs. And lastly, too much bilirubin in the baby's bloodstream from the antibodies attacking the red blood cells and destroying it, which releases bilirubin, can cause neuro issues. So it could cause learning difficulties or even other neurological brain dysfunctions, which is something we don't want. So let's get you tested, and let's safeguard the baby's future, and also maybe other future babies' futures. So let's do it, and I'll see you with the doctor in the examination room. And yeah, thank you very much.